Signing up for health insurance is critical for everyone, but it can also make you cringe. It's complicated.
So let's continue the conversation with Caroline Gomez. Tom, she is project manager for the Milwaukee Enrollment Network. You help people sign up for health care under Obamacare. What's your number one concern right now with the GOP's repeal and replace plan?
It's making sure that people don't feel overwhelmed or confused, which is half of our mission, and just making sure that people know where to go to seek assistance, and knowing right now that nothing is changing immediately and probably not for the next year or so.
Yeah, do you get a lot of calls on that?
Absolutely.
Yeah, I can imagine, because people are wondering, hey, all this talk about
what should I do, right?
Right. So the plan is still in place. If you bought insurance in January, that's what's going to cover you for the rest of the year, right?
Absolutely. Through 2017, probably even through 2018, people will be able to maintain their coverage through the health insurance marketplace. And then if they are eligible for the state's Medicaid program, Badger Care, they're also constantly available to seek assistance.
Well, I think that's the big concern that many people have who are on Badger Care, because with the proposed plan, you're looking at a big disconnect, or the state would no longer get funding to do things like Badger Care, correct?
Well, they would get a limited amount of funding, and so that could definitely change how many people are eligible, or what type of benefits they'll get. But right now, the best we can do is making sure that those who are helping, the enrollment assisters, navigators, brokers, agents, are doing their job to help people understand what it is now and what it could be later.
Let's talk about the Affordable Care Act and what worked. I had a chance to talk with Tommy Thompson, former governor of Wisconsin. He says Obamacare is in a death spiral. Let's listen to what he said.
Platinum, a gold, a silver, or a bronze. And we're going to put so many restrictions in there that insurance companies are not competing. They're pulling away.
So let me ask you about that. Did you see insurance companies pulling away? Was there less competition when it came to health insurance?
Well, I would say Wisconsin was kind of unique in that it remained pretty competitive. We did see one of the bigger plans leave the southeastern region, Anthem, Blue Cross Blue Shield, but they remained in the rest of the state for the most part. And we still had 4 insurance companies just in Milwaukee County alone, and there were still counties that had 6, 7 insurance companies.
And the large majority of your clients, would you say, are children?
Well, for the health insurance marketplace, it's actually mostly adults. Okay. But for the state Medicaid program, Badger Care, Milwaukee County has half of its children in the state Medicaid program.
So what did you think was working under Obamacare? What did it accomplish when we hear people saying there wasn't enough competition, or that younger people just didn't want to participate?
Well, and I think a part of it was that it needed time to kind of for people to get used to it.
Sure.
And so because it took some time for people to realize they needed health insurance, that they could get penalized if they didn't have it, there was definitely some slow to move individuals that didn't jump on right away.
Did costs go up?
To some degree.
I heard 25% these premiums were going
Well,
up.
and that was nationally, but here in Wisconsin, the increase was actually a little slower. I think it was a 4% increase this last year. So for the most part, we are seeing slight increases, but definitely not as high.
Not as dramatic as the national.
Before the ACA even. And then on top of that, there's the financial assistance that helps lower those costs for the majority of people. Here in Wisconsin, 90% are covered by financial assistance to help lower monthly premiums and deductible costs.
So does it look like a tax credit is better, or a deduction would be better for clients?
Well, in terms, are you talking about the new plan?
Yeah,
yes.
Compared to the GOP plan.
So the tax credits currently, they're based not only on age, but they're also based on your income and where you live, so depending on the cost of the plans in your area. The new proposal includes tax credits just on age, and it's kind of a flat fee depending on what age range you're in. So for a lot of people, they are not going to see as substantial financial assistance with the new plan. So unfortunately, increased costs.
So we just have a few seconds here. As you navigate these next few months, watching what's happening in D.C., what is your main focus at this point?
Well, it's just kind of waiting to see what they are really going to go ahead and pass, because right now it's all kind of up in the air of, is this going to go through? Is that going to go through? Are we going to change some of these options?
And everybody's in that boat right now as well.
Absolutely.
Wait and see.
Yeah.
Thank you very much, though.
Thank you so much.
All right.